discuss about patient, provider, and payer relationship. The US medical billing process revolves around three main entities. The first one is the patient. A person who needs medical treatment because of his or her illness or medical condition is known as a patient. Inpatient. A patient who is in the hospital for more than 24 hours is known as an inpatient. Outpatient. A patient who is in the hospital for less than 24 hours. In the US healthcare system, a patient who is visiting the doctor's office for the very first time or after 3 years or 36 months is termed as a new patient. In a similar way, a patient who is visiting the doctor's office within the period of 3 years or 36 months is termed as an established patient. Now, the second entity is the provider. A person who treats patients or a person who provides medical treatment is known as a provider or a doctor. In the US healthcare system, there are two types of providers. The first one is a primary care physician, also known as the PCP. A PCP is the first point of contact if any person needs medical attention. The PCP is going to do the initial evaluation of the patient's medical condition, and if further treatment is needed, he is going to refer the patient to a specialist, and hence he is also known as a referring physician. The next one is specialist. A physician who has more advanced medical training in a specific organ of the human body is known as a specialist. Example, a cardiologist who specializes in heart related diseases. Now coming to the types of practice. Individual practice. Healthcare providers or doctors who operate as sole proprietors. That means only one doctor in the practice, also known as individual provider. The next one is group provider. Healthcare providers or doctors who operate as physician groups or hospitals. Basically more than one doctor in the practice, also known as group provider. The third entity is the payer or insurance company. A company that sells policies to patients with a promise to pay for certain medical expenses in exchange for a regular fee called as premium. Now there are two types of insurances. The first one is federal insurance. These are government sponsored programs designed to provide medical coverage. These programs are usually not for profit and are funded primarily through taxes. The other one is commercial insurance. These are private insurance programs designed to provide medical coverage. These are for profit and funded by policyholders' monthly premiums. Now coming to facility. It is a place where medical services are provided to patients. Types of facilities. The first one is hospital. A healthcare facility where that provides inpatient, outpatient, and emergency services is known as a hospital. The second one is ambulatory surgery center, also known as ASC. Healthcare facilities where surgical procedures not requiring an overnight hospital stay are performed. The third one is skilled nursing facility, also known as SNF. A healthcare facility where nursing care and related services are provided to patients at a lesser intensity than an acute care facility like a hospital. The fourth one is home health. Healthcare services, which may be medical or non-medical, provided to patients and their families at their homes or place of residence, is known as home health. And the last one is hospice. A facility other than the patient's home in which palliative and supportive care is provided to terminally ill patients and attending to their emotional and spiritual needs. Thank you.